inspire, connect, and enable the ecosystem of entrepreneurs. Welcome to Hubcast by Impact Hub Lagos, a podcast for the Nigerian innovator, changemaker, and entrepreneur. In each episode, we'll bring to you exciting and inspiring content where we'll share knowledge, insights, opportunities, and real innovative stories from the Impact Hub Lagos community. As the bloodline of our economies, entrepreneurs need to be supported and given every opportunity and resource to succeed. It is our mission to empower you from intention to impact. This week, we're speaking to Abisola Oladapo, founder and CEO of Mumspring, a health technology company that is enabling access to essential health services for women and children using mobile technologies. Under her leadership, Mumspring has supported the health and wellness of over 2,000 pregnant women. Mumspring is on a mission to transform the health of millions of women and children. In this episode, we take a look at how Mumspring came to be and how the organization is addressing one of Nigeria's most pertinent health challenges, neonatal mortality. We also discuss how the company created its USSD solution for mothers and some key steps they took to gain momentum and growth.
Hello everyone, my name is Adeze and you are listening to Hubcast by Impact Hub Lagos. Today I have with me my friend Abisola. She is the CEO and founder of Mumspring and I'm really excited to talk to her today about her work. Hi Abisola, thank you for joining us.
Hi Adeze, thank you so much for having me.
Yeah, I'm excited. This is going to be a really good conversation because, a lot of the work that you do I'm really passionate about, as you know. So I'm really excited to get into this today. So to start out, just tell us a little bit about yourself and the work that you do at Mumspring.
All right, so my name is Abisola Oladapo and I'm the founder of Mumspring. And Mumspring really is birthed from a lot of personal experiences that I realized were larger problems. What do I mean? So about 4 years ago, when I had my second child, she was not able to breathe when she was born. She had to be in oxygen. She had to be on feeding tubes. It was the longest week of my life. That week felt like 5 years. Luckily she made it out and she's running around the house now and doing what all 4-year-olds do. But that week, after going through that week and also learning that some friends that I had lost their baby that presented the same symptoms, it just really freaked me out because I just thought, how can someone carry a baby to term and then the baby be born and still present issues without showing any kind of symptoms or indications while in the womb? It just really raised a lot of questions around what happens during pregnancy and all of that, because I'd taken it for granted because for the most part, I had a really healthy pregnancy and drama-free pregnancy. So I started researching and then I came about what they call neonatal mortality. A neonate is basically a child that is 30 days old or younger, and mortality, of course, is death. So it's basically newborn death is neonatal mortality. And would you know that about 1.1 million babies die every single year across Africa within 1 month of being born? And according to the World Health Organization, 80% of those babies should not die. So for me, I started having this nag in my chest, literally like this thing needs to be solved. At first it scared me. So I ran away from the problem for like a year. And I was just doing, because initially I already had a business called Mumspring that I had and the e-commerce business. So I just focused on that. But this thing just kept gnawing at me that this is a problem. It's happening like every day in Nigeria. Over 500 babies are dying. What are you going to do about it? And it was almost like it was like a higher calling, to be honest. And I kept thinking, I don't know what I'm supposed to do. So initially, we created a foundation which still exists even now that basically supports women in need, provides them with birth kits, sometimes even helps women to pay their hospital bills when they can't, and things like that. But then we're looking for something that was more sustainable and scalable. So we said we create something that has a business model that can be sustainable over the long term and still be able to impact women. So of course, there's still going to be the need for the NGO model but then there's also a space for a business model, and that's how Mumspring is what it is today. So what does Mumspring do today? Mumspring has a variety of solutions, but the core solution I'm going to focus on in this conversation is what we fondly call Agnes. And Agnes is essentially a tech solution that enables low-income women. This is women who are making 50,000 naira or below per month in Nigeria, maternal education from home without having access to the internet. And the best part is it's delivered in their preferred language. So whether it's Pidgin, Yoruba, Igbo, Hausa, and in voice, so they don't have to be able to read, because we know that literacy is a potential challenge. Additionally, this app enables them have 24/7 access to a midwife from their home without needing to have credit. How is this possible? We partner with the public sector, we partner with NGOs to be able to pay for this on behalf of the women. So it's been an interesting journey, because initially we saw a problem, but then we felt like the users and the beneficiaries of this thing could not pay for it. So we had to find another business model to reach them, which then led to the what you would call, I guess, B2B2C, which is another entity paying on behalf of the women. And that's where we are today.
Oh, that's really interesting, and that's such good and important work. And you've already kind of talked about the challenge that you're trying to address, which is neonatal mortality or infant mortality in Nigeria. So when you think about maternal health in Nigeria and infant health in Nigeria, what are some of the key problems or challenges that women face? You already kind of mentioned, lack of access and education. What are some of the other challenges?
So there's three things at play here. There's maternal mortality, which is death of the mother during pregnancy or the postnatal period. Postnatal period will be the first 6 to 8 weeks after having the baby. Neonatal mortality is death in the first month of the baby's life. Infant mortality is another different ball game. That's mortality. That's death in the first 12 months of the baby's life. So there are different issues. During pregnancy, the issues are around, whether the woman has access to antenatal care, antenatal education, access to be able to reach her doctor in time, if there's a problem, if she's able to eat good food and get good nutrition so that the baby can grow properly, if she's getting her supplements, and if she's also taking the right vaccines, to prevent certain diseases that are common in Nigeria. If she has all of those situations sorted out, then her maternal health is fine. So I just listed like 6 things that that could potentially be challenges for her. Then the baby is born. The environment where the baby is born is a factor. About 70% of the births happening in Nigeria are not in a medical facility and are not at the hands of a trained medical professional. That is a big contributor to newborn death, because there's certain training. And in the event of a breached birth or things like that, when you have a trained midwife or a trained doctor attending the birth, then they're able to do next and how to triage that to a secondary level or tertiary level hospital, as the case may be. When this birth is happening at home or in the local environment where many of these things are not available, then it's more likely that there's a chance that something could go wrong, because if there's a complicated birth or a distressed birth, by the time the woman can get to a hospital, there might not be enough time. There might not be enough time to save the baby. So as a result, there's just a lot of mitigating circumstances around the newborn. Also, let's say you have the baby safely at home. You need to keep the baby warm. They need to be at a certain temperature range. They need to be gaining weight within the first week. If there's no medical professional checking these things, then it's difficult for the mother to know what to do or what's wrong or what the problem might be. So these are some of the mitigating circumstances around the neonatal period. So that's the first month. In the first year, there's a whole slew of potential risks. So there's how well is the baby being fed? If the mother is being fed well, maybe she's then likely to be able to breastfeed the baby properly. But if the woman is not even getting adequate nutrition during that period, then she's likely her milk is going to be compromised, and that's going to affect what the child is getting. By 4 months, a child should be able to have supplements and be able to have other foods that balance the child's diet. If there's socioeconomic challenges that prevent that is likely to put the child at risk. The child is supposed to be taking vaccines. If the woman cannot afford transport to take the child to the hospital, then so there's medical, there's socioeconomic, it is a complex
It
situation.
is very complex.
To be honest, yes.
Yeah.
So for us, we've started with this solution of, because we started with, the reason why we started with, there are many things we could have started with.
Yeah.
We could have started with, let's find a way to help the women have money. Let's find a way to help the women be more educated so they can get better jobs and things like that. But we realized that because we're trying to focus on maternal, newborn, and infant health, the core connecting factor there is the pregnancy, the birth. That's where it all starts. So we started with education, because what we're doing is using education to empower the women so that they can come into recognition of, this is what I need to be doing, this is how I need to be eating, this is what needs to be made available for this child. So once you have an awareness, at least then you can take steps. But if you don't even know that you need something, then you can't even do anything about it, even if you have the resources. So that's why we're starting with education over time. So that, and with education, and then we're starting with the midwife triage. In the case of emergencies, they have help. But then over time, we're trying to add on services so that both medical services and also services that will enable them be able to start to create socioeconomic opportunities for themselves.
Yeah.
So yes, I'm sorry. Like I don't know how to contain that answer into like a quick sentence.
No, it's fine. I was just
complicated.
It's a very complex issue, and I think you've kind of illustrate how multifaceted some of these issues are. Like even in our experience working with maternal health, you give women access to for example a midwife, and then they don't have phones to call the midwife. So there's so many different things that can pop up when you're working maternal health.
Yeah.
And many of the issues that we're facing in maternal health in Nigeria are very complex and intertwined. They're just, sometimes they can feel a bit overwhelming, but you've already highlighted how you decided to pick a specific thing to focus on with your solution. And we're going to come back to that. But in terms of, the overall problems that Nigeria is having with maternal health, apart from, some of the solutions that businesses like yours are, trying to, give, what are some of the structural, solutions? Can you just maybe highlight about 2 or 3 structural solutions that need to happen within the health sector for there to be an improvement in, neonatal health and maternal health?
So one of the big challenges is access to health financing. So yes, you you have a health need, but how do you pay for the service? And this can be solved through, in some countries you have like a national, health insurance scheme that is accessible to everybody as long as they're a citizen. In some places, another potential solution is to have insurance that is affordable for all. So everybody can pay, but they pay what they can afford. That is a big concern, because in some cases what we found, some of the women is they know they need the care, but they simply can't afford it, especially with COVID-19. So many of them have lost jobs. Many of them were, tailors, they were caterers, and now nothing, no source of income at all. And so it's just been a very difficult situation. So I think first of all, health financing is important. Okay. Secondly is accessibility of primary healthcare centers. So sometimes you find that in not necessarily remote areas, but in some densely populated areas, the distance between the number of health centers per capita
is not sufficient.
It's so low. So the distance they even have to go, the amount of money they have to spend to get to the nearest health center is so much that it's, to be honest, it might be a bit discouraging. And the thing with labor is labor can happen at 2:45 in the morning. Yeah. And these women many times don't have a car.
Yes.
So, and there's even if let's even say they went to get a bike, there's no bike available at 2:45 in the morning to carry you to the health center. So that's also a fact. So we need to have either emergency care services that are, across board, regardless of your background, which then still ties back to the financing situation. So I think financing is a key part, because whatever you're going to do has to be financed somehow, whether it's national insurance, whether it's, something else. But there needs to be a way to be able to pay for all the different health services that need to connect. So I think if we're going to sort out one key thing, I would say health financing, and then also the distance to at least a primary healthcare giver should be, we need to look at making sure that there's more per capita.
Okay. So going back...
and one more thing before you move on. You also realize that we're experiencing a mass exodus of medical talent out of Nigeria. Yes. So, and a big part of it still comes back to financing. Many times it's, they've trained, they've gone to medical school for a long time, they're very highly trained, highly professional, and then the opportunities available to them just don't match up with the level of investment that they've made. But as the sector starts to receive more investment, receive more attention, and to be honest, that has been accelerated for better or worse due to COVID-19. Now everybody's realizing that your health literally is your wealth, because if you're not alive, then everything else you're doing, if you're not healthy, then there's no point. So hopefully we'll start to see more investment in that sector, and then start to see more development, start to see more hospitals, we'll start to see just more availability of healthcare services.
Okay. So bringing it back to your solution, which is the USS platform, right, for mother, where you said people can access healthcare for like antenatal healthcare, even in low-income communities. So how did you build your solution? You came up with the idea. What was the first step that you took? Because obviously you needed, developers and like a team to help you with that. What was that process like?
Okay, so the way ours happened with this particular solution is, let me tell you, see how it happened, and then you will see how it came together in the story of how it happened. So we already had an app, a smartphone app called the Mumspring app, which was for people who had access to the internet, and they could get a lot of antenatal content and and information and a lot more, or community, a lot of features on the app. And then we, as part of some of the work that we do with our foundation, we were doing some outreach across about 11 local governments in Lagos, and we started thinking, how can we apply what we do to support these women? And first was, okay, can we somehow give it to them for free? Because since we're using the internet, maybe it's a little cheaper. Maybe we can do something with our foundation. The foundation can find some funding and we can make that happen. But then we realized very, very quickly that many of these women could not read. Many of these women could not afford the internet, and many of these women did not even have smartphones at all. Right?
Yeah.
So we said, if we're going to create a solution, it needs to be independent of the internet. It needs to languages that are indigenous to Nigeria, so that the women can actually use it, and all of those things. So because we already had a solution, what we then did was we took the core bits of the solution that we had, then we further, because we already localized it for Nigeria, but then we further localized it for the indigenous women that we were trying to support. So we turned it to voice. So we had to get translators, we had to get people to transcribe and translate and voiceover work that needed to be done. So there's a lot of content regeneration that had to happen there. Then we already had a development team because we already had an infrastructure because we were already a tech company before this opportunity happened. So we just redeployed our tech team to focus most of their efforts on building this solution for the women. But it was a different context because we had not done anything in the USSD space before. So it was some learning even for our tech team. But, as we tend to be I think that's one thing I have to give my team. We're very hungry learners. So if there's anything new, any new technology, we're very quick about learning about it, figuring out if it's something that we need to adapt or not, and then and then bringing it on. So I give kudos to our chief product officer and our CTO, because they are the ones who are just, I'm the one who will just come and say, guys, we need to do this for these women by this day, and then I walk away. And then they look at me and sleepless nights begin, and all of a sudden we have a product. That's how, we have a good synergy that way there, but yeah, that's basically what happened. Is we already had a team, we were already structured to deliver solutions for mothers. That's what we do at Spring. And then this opportunity came to do this, to be able to solve this problem for this segment of the market that has gone largely underserved, because it's seen as a market that cannot afford the services. So a lot of tech companies don't build for them. So that's how the opportunity came up.
So how did you now market the product? Like, how did you grow the product so that, women in different communities are able to use it?
We partner with two kinds of organizations. We partner with the public sector, so the primary healthcare system, and we partner with community-based organizations, because these are the two key entities that have a keen interest in ensuring that these women don't continue to go underserved. So what we do is, so we find entities that are either interested in solving the issue of maternal health or newborn health, and then we provide this as a service to them. And so it's, for example, let's say you are a UNDP, and then you decide that you want to help 10,000 women in 60 local governments somewhere in Nigeria. We can help you provide this service to the women as part of whatever solution that you are planning to do for the women. The same thing if you're a corporate entity, the same thing if you're a state government. we will basically provide this service to you on behalf of the client. So what we do is market directly to those entities that have that kind of interest. Yes, who are like, okay, all right, so if UN Women, or our mission is to help women, our mission is to reduce maternal health, our mission is to reduce newborn health, then we are a partner that can help you with our technology.
Yes. Okay.
Yes, to accomplish that mission.
Yeah. So it's basically like a sponsorship approach. So you have basically like sponsors or partners.
I guess you could call it. So we look at it as a distribution approach.
Okay.
But you could look at it like that if you're looking at it from an NGO lens.
Okay.
From a business lens, we look at it as a distribution approach, because we are like, you are like, now Lagos has 20 LGAs. And you can either physically go to all LGAs and try and reach all the women there, or you can reach the Primary Healthcare Board of Lagos State and use that as a distribution point to reach every single LGA in Lagos. Right? So we see that as a distribution point.
Okay. That makes a lot of
or
sense.
Distribution source.
So how do you determine like the price points to ensure that you are a profitable business while still maintaining, you're working with women who cannot afford the services that you're giving them, right?
So the way we look at pricing is we look at what is the value that we're providing to the clients. Our clients in this case is, I guess to use your words, is the sponsor.
Yeah.
It's the government, or it's the NGO. And so really the person whose utility we're looking at is the client, not necessarily the woman. So as a result, we try to price fairly, looking at other options for providing the service, looking at what other costs they would have had to incur, and we make sure that we are competitive with that price. Because it's very important for us that we are a sustainable company in the long term. So, because we want to be able to be here, Nigeria alone, right? Every single year, we're having 7.3 million babies, but 6 million pregnant women, because we have multiples, twins and triplets. Every single year, we're churning out babies like it's like the baby factory. So we need to be able to be around to support all these women over the long term. And also, we want to support the women, but we also want to support our teams. We want to be able to support the families that support the team. Every single team member we have is a product of a family, or is part of a family. And for every job that we create, we are supporting another family in Nigeria, in the Nigerian economy. So we need to be able to create good careers for those people so that they can be good contributors of tax and to the Nigerian economy as a whole. So for us, we have to balance that need to help the women, but also the need to create good careers and to further the economy of our nation. And we cannot give one for the other, because it's a symbiotic.
Yeah.
Right? Because we need these engineers to be happy so that they keep making good solutions and they keep innovating so that we can keep helping these women.
Yeah, that's a great answer. And it makes a lot of sense. So what is the most important thing you've learned so far as a businesswoman, but specifically in the healthcare sector as well?
Oh, wow. What's the biggest thing I've learned? I've learned a few things. So one of the big things I've learned, especially with Nigeria, is that when it comes to health, it is one of those things that, of course you will have exceptions to this rule, but in general, it's not the topmost priority on people's list. Because there's still so many issues in the nation, so people are still worried about how they're going to eat, put food on their table and things like that. So COVID really, really made health a lot more important to people. People who haven't taken vitamins in their whole lives are now downing 5 vitamins a day. And so it just shows you how we tend to just ignore some things that are necessary and important. It's only when people are trying to lose weight, you see that they start to be healthy. Once the person is skinny in Nigeria, we assume that they're healthy. But I think one big thing I learned was how much we threw our health, our personal health, to the back burner as a people, until it became apparent that you needed to be healthy to be able to get through what's going on in the world right now. And I just hope that with everything that we're learning now, that we keep the healthy habits that we started to build, and that we are building healthy habits as a nation. And then also, healthcare is also a sector that has received one of the lowest investment traditionally in Nigeria. But now you're starting to see a lot more people look at health tech, a lot more people looking at how do we rebuild the healthcare infrastructure, how do we actually invest in this sector? Because reality is, and that's what the Western world have noticed, is until you have a healthy people, a healthy population, that you can have a productive population. If your team members at work are mentally healthy, physically healthy, psychologically healthy, then they're able to bring more to the table and be more creative. But if they're stressed out, they're having malaria every week, they can afford to go to the hospital because you don't have insurance, then it just affects productivity. And then as a result, you're not able to do as much. Your output is smaller. So to prosperity, I believe one of the key keys, I believe healthcare and education are equally important to prosperity in a nation. And this has made it very obvious, this pandemic. I just hope that the lessons we are learning, we keep it even post-pandemic. Because I know that sometimes, not just Nigerians, human beings, we tend to be very, very, we forget.
Yeah.
It's easy. You know what? This pandemic is over.
Yeah.
So that's one key thing is, how we need it. And even personally, is I found that, mental health is so important, especially at this time, because you're hearing so much bad news, you're hearing the data is just crazy, and it just really makes it important that we all take care of ourselves. Even when we look okay, we make sure that we are feeling okay, because it's just, we only have this one life.
Yeah. So the next question is kind of two parts. So I want you to share with us some of the biggest wins that you've had as a businesswoman working with Mumspring, but then also some of the most difficult challenges. So maybe you can give one of each.
I would say one of the biggest wins we've had, to be honest, would be actually this product that we have, Agnes. Because the level of scale we are able to reach with the product, because it's so localized, it's so focused, it's probably the biggest risk we ever took because it's so focused, right? It's just one niche. It's in localized languages. If it doesn't work, it's like you've invested so much. But then if it works, we've crafted a nice corner of the market for ourselves. And it's been really exciting. One of the biggest ones we've had, because of the volume of interest that we have, the volume of growth that we're experiencing has basically changed the entire projectile of our organization. So it's really, really exciting for us right now. And one of our biggest, challenges actually led to Agnes. So now we see it from a positive light, but when we were going through it, it was like, oh. So we start a bit of history about Mumspring. So we started 2017. We were an e-commerce company with, also this mission of trying to help women. But our plan back then was just to put a percentage of our profits and our equity towards the foundation, towards helping low-income women. So we thought, okay, when we grow big, we'll be able to do more. So we just keep growing organically with it. And as you know, in Nigeria right now, e-commerce is a marathon, not a sprint. So e-commerce, it will eventually become a big thing, but it will take time. There's a lot of challenges around e-commerce in Nigeria. From logistics challenge, actually logistics is 80% of the challenge. And because it's very expensive, and the reality is that there's a lot of currency and financial pressure on the end consumers. So then that pushes down your margins as a business and then affects the quality of staff you can hire. And so it's a really tight area. And knowing that the big companies that have tried to do well in this space have not necessarily been able to be the success that they promised to be in the e-commerce space. Funding for e-commerce right now is a bit tough or almost impossible to get. Except you're a manufacturer. If you're not a manufacturer, then it's going to be tough to get. So we were in that spot of, being an e-commerce company, struggling to find financing. We created this smartphone app, and at that point, we thought to keep it free because our entire plan had been to make money off e-commerce. But e-commerce wasn't working as fast or wasn't growing as fast as we expected it to grow. And so we were getting to the point where, and as a startup, it's either you grow organically or you get external financing. External financing wasn't funding e-commerce. The growth wasn't giving enough margins to be able to sustain hiring people. So we were getting to the point where it was like, we need to either find something to be able to let this thing take off. We had to consider just packing up and realizing that it didn't work. And in the middle of that we were looking at, okay, who else can use our solution? And we uncovered that, there's this whole slew of these underserved women that we've been trying to serve. We can modify our product and give it to them. And then we're like, but how would they pay? There's people who are interested in paying them, paying for them, but they're just looking for the solution to do it. And it was everything changed from there. So it was just the constant pivoting and constant just thinking of how can we. So we literally had the right product, but we started with the wrong market. But now that we started with the right market, which is the underserved market, we're now getting more interest with the market that can pay. We're not seeing more people asking us, oh, your Mumspring app, we want it. Come and partner with this person and that person and get. So it's quite interesting what Agnes has now done for us, because it's now giving the other solutions that we've had before more credibility, because they're like, oh, you can deliver here. Fantastic. What else can you do? So yeah, even though it was supposed to be something that was going wrong, because we were able to keep pivoting and not give up, because my team and I, we kept going at it for months. And there were months that I think other members of my team had to ginger me. There were months that I was the one gingering them. So we literally, now we're like brothers and sisters, because we've been through it all together. And now we're here, and it's really, really exciting to be. I think that's why we're all so proud of where we've come, because we know where we've been.
So I just have one more question for you today. What would be your advice for any entrepreneur that's starting out in the health sector?
In the health sector, I would say the health sector is very big on, there's a lot of nuances to the health sector, from how payments work to, there's just a lot of infrastructure challenges that you need to first understand in the health sector. So I think that's important. But of course, like with any other business model or any other sector you're going into, first understand your market and understand it well. I think that was something that would have accelerated our growth even with the previous app, is as we've been doing Agnes, and we've now learned so much more about the health sector that is now helping accelerate our other products. And because before we didn't have that understanding of, first, like many women don't want to pay out of pocket for medical expenses, even the affluent women. They'd rather have insurance and have insurance put out most of the billing. So if you want to do something in health, you need to make sure that you can attract insurance companies, right? Because otherwise you then have to get each client one at a time, which is going to increase your customer adoption costs. And then you fall into the same challenge that e-commerce is facing. Convincing one customer at a time is very expensive. So the reality is, with the health sector, if you have a background in health, it helps. I worked in medical technologies in the US, so that helped a little bit. But the nuances of working in the Nigerian health sector as a health tech company, they are unique by themselves. So sometimes you have to just, start and just learn as you go. But don't be afraid to ask questions. I'm always asking questions of my doctor friends, my people that I know that work in health insurance. And that's what helps me understand the ecosystem and how everything works. I think the biggest thing you can do as a founder is assume that you don't know anything. Because then you are able to come to conversations and not be afraid to look stupid. And you'll be surprised what people will tell you when you are able to openly ask, what do you mean? How does that work? And people are always ready to look smart, to start teaching you things. There's times that I sit down in conversations about things I know, but then I find that I will get a new nugget I didn't know before. But when you come into a conversation assuming that you know everything, then people are like, well, you know the answer, so I'm not going to help you. But if you come, take off that pride of I'm CEO or I'm founder or co-founder, you'll find so much help is available. So that would be my big.
Thank you so much. That was a really good tip. Don't be proud. Thank you so much, Abisola. This was a really, really great conversation, and I learned a lot. I'm sure our listeners will learn a lot as well. So thank you for joining us today. Okay, thank you everyone for having listening.
Me. I really appreciate it.
All right, thank you, Abisola.
All right, take care.
Bye. Thank you for listening to today's episode with Abisola. My name is Adeze. I am the communications lead at Impact Hub Lagos, and you are listening to Hubcast. Till next time.